Is your dog straining to poop, looking uncomfortable, or maybe hasn't gone in a day or two? It could be constipation. While it's not common in dogs, it can become serious if left untreated. Hi, I'm Lyndall from Vetster, and all of the information in this video has been reviewed by leading vets to veterinarians, so you can feel confident knowing what to do next.
Constipation means a dog is having trouble emptying the colon. You might see straining with little or no stool, or they may only pass small, hard, dry poop. But not all straining is due to constipation. Dogs often strain when they have diarrhea, which is actually more common. And straining to urinate is a medical emergency. Sometimes a dog won't poop for a day or two after surgery, fasting, or recovering from diarrhea. If they're not straining or showing other symptoms like vomiting or lethargy, they're likely fine. If constipation isn't treated, it can turn into obstipation. When the stool is so impacted, it has to be removed manually. Or megacolon, where the colon becomes stretched and can't work properly. Both conditions require veterinary treatment and sometimes surgery. The most obvious sign is straining to poop without success. Other symptoms can include vomiting, lethargy, loss of appetite, a bloated or painful abdomen, blood around the rectum or in the stool. Keep in mind, diarrhea, urinary issues, or infections are more common reasons for straining. If you're unsure, talk to a vet. Your vet may check for hard stools during a physical exam and may use x-rays to see how full the colon is. Dogs who haven't pooped due to fasting or anesthesia aren't necessarily constipated unless they're straining or showing other symptoms. Since constipation usually occurs secondarily to another medical issue, a thorough diagnostic workup is often necessary to identify and treat the underlying cause. This is the primary concern for dogs presenting with constipation. Tests might include blood work to check for diseases like kidney problems or diabetes, and imaging to look for internal blockages. Treatment depends on the cause. If your dog ate something hard or indigestible, the constipation may resolve on its own once that's passed, as long as they don't eat it again. For constipation linked to medical issues, the underlying cause needs to be treated. Vets may also recommend rehydration with fluids, enemas, only done by a vet, laxatives or stool softeners, fiber supplements, manual stool removal under anesthesia. Do not give your dog an enema at home. It is unsafe. Dogs with recurring constipation need long-term management from a vet. This could include a therapeutic diet, medications or therapy for mobility issues like arthritis, regular exercise, weight management, ensuring easy access to water, treating chronic diseases like liver or kidney problems, surgery if tumors or other issues are causing a blockage. Constipation happens when something interferes with how feces moves through the colon. This might be due to dehydration, chronic diseases like kidney or liver disease, spinal injuries or nerve problems, prostate enlargement, tumors, or matted fur, eating bones, drywall, or other hard substances. Older dogs, dogs with mobility issues, or those with chronic disease are at higher risk. That's why regular wellness exams are important. If your dog is constipated, your vet might recommend safe at-home steps such as light exercise to stimulate bowel movements, switching to wet food or increasing water access, adding fiber like canned pumpkin to the diet, keeping the rear end clean and free of matted fur. But don't try new remedies, even natural ones like olive oil, without talking to a vet first. Constipation is uncomfortable but manageable, especially when caught early. If your dog is straining or seems off, check in with a vet. Online platforms like Vetster make it easy to get professional advice fast. Thanks for watching. We'll see you in the next video.